I'm sorry, I was on healthcare.gov. It actually works. How's it going, everyone? I'm Joey Jingola with Jingola Insurance, and on today's health insurance break, I thought there was really nothing more important than I could do for you than actually take you through a step-by-step visual tutorial walkthrough of healthcare.gov, as it actually met its deadline of November 30th, and over the holiday weekend opened for business for a second time, if you will. So I'm going to walk you through right now. We're going to hop in on the computer, get behind the desk here, and show you exactly what you are in store for when you go to sign up for coverage. Let's go ahead and do that right now. All right, so here we are on healthcare.gov. We're going to go through the main event here and walk you through the application process and kind of show you what you're going to be in for. And we're going to go ahead and click on the big, shiny, bright yellow button here, apply now. And this is we're just kind of going to walk through it here. You'll need to select your state. I've already done that. And we're going to click apply online. It's going to take you here, get started. All right, fantastic. And now I've actually already got an account created, so I'm going to go ahead and log in. And so I'm going to go ahead and log in here, and now it's going to ask me what I would like to do. Pretty straightforward. And you're going to want to go ahead and apply for family coverage. So now we're going to go ahead and scroll down here, click next. And we're going to start the application process. So now you'll notice here that you will need names, birth dates, and income information for your entire family. Also including social security numbers if they're available for the people who want coverage. All right, now we've got to go through their privacy policy here. Now this is just basically going to say that they're keeping your information private as required by law, blah, 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 blah. You'll notice here it says important that they could retrieve information from your information from the Internal Revenue Service, IRS, Social Security, or the Department of Homeland Security. So be on the lookout for any sort of not very subtle black sedans sitting outside of your house. Possibility, I don't know. So, but anyways, we're gonna have to go ahead and agree to that, save and continue. Here you have to provide them with your contact information. What do we miss? I would like to read my notices online. They can send them to me in an email. They can send them to Joey, Jingola at gmail.com. Now, of course, you guys may know I am married, have 2 children, but for the sake of simplicity and your time and sanity, just going to do this application as a single person so I don't have to go through that whole process. Verify my address. All right, so now here's a little spot in the application that's a little important to me, and I'm going to stop for a minute and bring this to your attention and just say that if you have watched any of my videos, read any of the blogs, downloaded any of the material, and if any of it has helped you make a decision in any way, shape, or form, and you would like to have me on your team, basically have me as your health insurance assistant, if you will, and allow me the ability to service this policy, help with any problems, questions with your billing, with claims that may or may not be getting paid, then you're going to want to go ahead and click here for an agent or broker. Let them know that somebody's helping you. Now, if you're working with somebody else, you haven't, this is the first thing you're watching from me, you've got somebody else that you're working with. If it's a navigator, if it's a certified application counselor, whoever it is, you're going to want to go ahead and check the appropriate box. If it's another agent, check the box and then put in their information here. So for me, you'd want to put in, obviously, first and last name. First name is Joseph, Joseph. Middle name, Ralph, Ralph. Yes, I know. And Jingola. And I am Junior, named after my dad, which is very important because he is also a health insurance agent in Ohio. So the organization's name is Jingola Insurance Agency Inc. is the official name. The FFM user ID, that stands for Federally Facilitated Marketplace User ID, and that's just simply my first and last name, capital J, capital G, no space. And the real big one here is my National Producer Number, or NPN, and that is 14143939. Doesn't get much easier than that unless it was just one number, the entire thing. So if you do want any help with that beyond this process here, beyond this point, if this is not here, then myself or any other agent or whoever will be locked out from helping assist you with this policy at any point in time beyond. So it's very important that you make sure that you have this completed properly. Once you do, go ahead, save, continue, and now you're going to want to set a security question for that person that is that you've granted access to. So in what city, town was your first job? Ashtabula. Okay. And now this is an important part. Do you want to find out if you can get help paying for health coverage? This is the main and only reason that you're actually here. So you're going to want to go ahead and obviously click yes. If you click no or you're not sure, then you're probably in the wrong place and you don't need to be here, because if you don't want to find out and you're not looking for tax credit or subsidies, you will not, I repeat, will not want to apply through the marketplace, because it will greatly limit the options that are available to you. So just keep that in mind. Who's applying for health coverage? Just going to be me. Like I said, for the sake of simplicity, got my birth date already in there. Save and continue. I am a male. And Social Security number is optional right now, so for the sake of me not giving it out to the entire world, I'm going to skip that step, but you're probably going to want to include your Social Security number right there. And we'll just say yes. I am a U.S. citizen, and I will be filing a federal tax return. I am married, but I'm just saying no for the, again, simplicity's sake here. No dependents. I do have children, just, again, saying no for simplicity's sake. My family hopefully is not watching this. Will Joseph Tringola be claimed as a dependent? No, I will not. And we're moving on. And I am not Hispanic, Latino, or of Spanish origin. I would probably be considered white. And now we're going to provide them with more information on the household. Basically, I know if anybody below, that's me, has a physical disability or mental health condition. No, I do not. Well, that's up to you, but are any of these people American Indian or Alaska Native? Oh, again, I am not. So you can see a lot of just no's throughout this process. Now, this is the summary of the family and household information. You can go ahead and review this information here. You can edit it right here or right here if you find something that you messed up on or overlooked. So we're going to save and continue. Moving along real quickly here. Now this is going to get down to the nitty-gritty as far as the income goes. Again, pay stubs, W-2, other information about your income. This is where this is all going to come in handy. Does Joseph Tringola have any of the following income? I do have a job. Yes, that's what I'm doing right now. I'm working. So we'll say job. Just for example's sake, we're going to use $30,000 as our example. That's what I've been using throughout the course of this whole kind of process. And let's say this would be, do they give me yearly? Yeah, yearly. Okay. So go ahead and select yearly, save, and we're going to save and continue. So based upon what you told us, steady income, that's about $30,000 per year. Is this how much you think? And now this is, again, very important. This information, this financial information, is going to be based on a projected 2014 estimation of your income. So they're going to ask you what you normally have made over the last year, and then they're going to ask if you think that that's going to be fairly similar from the previous year. So I'm just going to go ahead and say yes. Now we've got, obviously we're keeping moving here. We can review the information, edit it if we see anything that we don't like. Total monthly income right there, save and continue. Income summary is very short and sweet. Now we're on to any additional information. You may need information, current health coverage, blah, blah, blah. Job-related coverage, if you're eligible for insurance from an employer, that information as well. Is Joseph Tringola enrolled in health coverage from any of the following? No, I am not. And again, I do have health insurance available to me from both my employer and my wife's employer. So this is where if you have that available and it is affordable, you are not going to be eligible for subsidies within the marketplace. So if you're not eligible for subsidies, then you really shouldn't be here anyways. All right. Is Joseph Jingola currently eligible for health coverage through a job? Again, for our purposes of this demonstration, filling it out similar to what you would probably be filling it out. I'm going to say no. Save and continue. Will Joseph Jingola be eligible for health coverage from a job during 2014? Again, I'm going to just say no. So this is asking for the information of my place of business. Shapula, Ohio, 44004. All this is optional. Place phone number. That's the only thing I need to give them. All right, moving on. Providing a social security number may help get a better idea of how much help you can get, how much money you would possibly qualify for. So again, you're going to want to include that, again, without sharing it with the entire world. I'm sure there's a way to black it out after the fact, but we're just going to leave it off for now. So now we're going to review and sign the application. And we're just going to make sure to give a brief skim here, make sure this information is all accurate. It all looks pretty good outside of the stuff that I, again, blatantly told you I was lying about. Want to know if anybody on this application is in jail? I don't think so. Now this is important here to make it easier to determine my eligibility for help paying for health coverage in future years. I agree to allow the marketplace to use income data, including information from tax returns, for the next 5 years, the maximum number of years allowed. The marketplace will send me a notice, let me make any changes, and I can opt out at any time. Basically, this means is that they're going to be able to pull your financial information for the next 5 years to basically, the way that it was worded on the paper application, it doesn't say it here, but essentially renew your marketplace coverage for 5 years automatically. So if that's something that you're not thrilled about, you can go ahead and click disagree, and you can say don't use tax credit, don't use tax data to renew my eligibility for help paying for health coverage. Selecting this option may impact your ability to get help paying for health coverage at renewal. Now, keyword at renewal. That means that you will just have to go through this process again at renewal, and that it's not going to affect anything that we're doing right now as far as the amount of money that would be available to you. So you could do this, or you could allow them to do it for 1, 2, 3, 4, 5 years, whatever you feel might be sufficient. So again, for just the purpose of this, we'll just say agree, and then I know blah 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 that you can make any change to the application, call into that number, so on and so forth. Moving on. Basically now this is where I will obviously get rid of this application when we're done, but they're asking if everything that you provided is true to the best of your knowledge. You're gonna go ahead and agree. I will just sign here, and we're gonna submit the application. Now here's the one thing is that we are submitting the application before we've, as you can see, been able to actually see any plans. That is the one downside of this, because you're going through all of this before you even get to a point where you're going to see a plan, see what it costs, find out what your subsidy amount is. I think that's important. But you can, there is a section where you can see plans before you buy, but again, you don't really have that subsidy number fully confirmed. So I can see how it goes either way, but if you click view eligibility results, it's just going to give you the option to view a PDF of your eligibility results. So you can go ahead, obviously you see I can save that. I'm going to go ahead and just not do that right now. We're going to continue to the enrollment. And now we're at the main event here. This is where we can actually start to see some plans. First, we do have to go click here, set. And this is going to allow you to verify your smoker status, your tobacco use within the past 6 months. So if nobody's used any tobacco, 6 months, you're good to go. Coming back now, finally able to here, clicking set again, view plans. This is just going to be kind of a brief overview here, and we're going to just close out of this. And we've got just kind of a show and tell moment here. We've got select your plan, catastrophic, bronze, silver, gold. Gives you kind of an overall snapshot, highs, lows. I really, really like these green bars. I have to say, I am smitten with them. This is a great idea. Fantastic job, whoever came up with this. Basically showing you where you fall on, where you fall with like the limits of these policies, how close you are to meeting them with these bars, and it's a great visual representation. Very simple, very effective. Fantastic stuff right here. So you can kind of see the plan breakdowns 9 gold, 11 silver, 13 bronze, and 4 catastrophic available here in my state of Ohio. So we can go ahead and click out of here, and this is going to bring you here. We've got 37 health plans. You can sort by the metal or by catastrophic. So you can click, you know, if you want to see just the gold plans, go ahead and click gold here, and it's just going to bring up the gold plans, and you can see $278 a month for what would be the most affordable gold plan. These are sorted based upon price right now. You do have the option to go by premium, by maximum out of pocket. So that would bring the lowest maximum out of pocket up here, which would then bring up one of the more probably expensive plans. And then you can just sort by names A to Z or Z to A if you want. If you're looking for more details on these plans, which you probably should, you'll have an opportunity here to look up the plan brochure. But last time I checked, some of these were not working properly. Looks like, again, see page not found. So some of these links for these companies not fully linked properly yet. This is CareSource. You know, we can look at Medical Mutual here. They've actually only got 2 links at this point. Summary of benefits. This one should be working. Yep, this one's working pretty good. Provider directory was not working earlier today. As I was looking at it, it brings you, yep, see, here we go. Doesn't have anything. Again, if you want more information, just go ahead and click details here. It's going to show you everything that you need to know, a little bit more in depth, a little breakdown on the plan. So this is where the nuts and bolts of it are. This is something you're going to want to look at. You're also going to want to make sure that you go and check these provider directories as soon as they are all updated and available, because that is one of the biggest differences of these plans, is that these networks of doctors and hospitals are getting kind of screwy, getting kind of skinny, if you will, and you're not going to have as many options as you maybe were accustomed to or maybe would like to have moving forward. It's pretty simple. You just click enroll, and you would confirm. And we're not going to do that because I obviously don't want to apply for a plan. Well, actually, we can go ahead and do that. It's going to bring us back to here, and we can then, you know, we have our dental plan to pick, review, and then we'd finally confirm the coverage. So you go through these set, you click set for the dental, pick your dental plan. I guess we can take a peek if we want. Why not? We're already here. And you can buy a separate dental plan, or no, I don't want a separate dental plan. Dental not included in the health plan, so that's not going to be, so that's what you could do here. So if, let's see, click no, I don't want it, I'm going to take us back, I would imagine, here, and then you would have the opportunity to review your coverage, and then obviously finally submit that application. So you notice, because I didn't provide them with all of the most accurate details, we weren't seeing any subsidy credits on those applications. And that's you know, you're going to want to go in and get, you know, provide the Social Security number, give them the information that they're going to need. But that's pretty much it. If you need to go back in, you can go back to your account here, and then look at your applications or your profile and make any changes. But this, for the most part, is healthcare.gov from start to finish. Didn't take all that long, didn't run into any problems for the most part. And once you do that and you've got all that proper information, you got the right plan, you should be good to go. If you have problems picking out a plan, I'll go ahead and include a annotation right now for you to click and watch my best of Ohio Health Insurance Marketplace plans, which will go through the 3 plans that I think you should probably consider if you're going through this process, and help eliminate those, you know, from those 37 that are available, narrow it down to just 3 and see what one of those 3 might work best for your situation. All right, so there you go. That's it. It's relatively easy. I mean, outside of inputting all of that information and making sure it's all being accounted for and you've got the right amount of subsidy applied for and so on and so forth. We've been talking about it for so long. That's it. We just saw it. We did it. We went through it. And hopefully this will help you understand what it is that you're going to be doing. So, of course, if any of that didn't make any sense to you, if you're unsure about how to pick the right plan, you need a little more help, I would just encourage you to reach out to me at any point in time. Give me a call or shoot me an email. Email is right there. And I'd be happy to, you know, talk with you and you know, discuss your situation, your specific situation a little more in depth. So I do want to thank you for taking the time to watch this video. It means a lot to me. I really appreciate it. And of course, if you found this information helpful at all, you found this walkthrough, this tutorial helpful, well, I would encourage you to go ahead and hit that like button to let others know that this might help them out as well. And of course, as always, I am Joey Giangola with Giangola Insurance. Take it easy, everyone.